I'm Joe Alton, MD of Survival Top 50's Reader's Choice website, doomandbloom.net, with over 1,000 articles, podcasts, and videos on medical preparedness. Together with my wife, Amy Alton, an advanced registered nurse practitioner, we're the authors of the Book Excellence Award winner in medicine, The Survival Medicine Handbook, now in its 700-page third edition. Also, the brand new book, Alton's Antibiotics and Infectious Disease, the Layman's Guide to Available Antibacterials in Austere Settings, and the designers of an entire line of medical kits and supplies at store.doomandbloom.net. I guess I should start by saying that the information in this video is only meant for circumstances where there is no functioning medical system. If modern professional care is available, for goodness sake, seek it out. If a disaster throws you off the grid, your risk of traumatic injury increases, and so does that of infection. When somebody thinks of an infectious disease event, they envision a deadly epidemic or pandemic, but any catastrophe can increase the number of people with infections. When I say catastrophe, I'm not talking about losing power from a storm for 3 days. I'm talking about a true long-term survival scenario. Now, in these events, these horrific events, you can expect that dirty wounds, contaminated water, poorly prepared food, inadequate sanitation, all those things will turn healthy people into desperately sick ones. With antibiotics in your medical storage, however, you have a good shot of nipping those infections in the bud, at least some of them. Without antibiotics in your storage, however, you are heading for a bad outcome. Now, one of the most frequent questions I receive from readers, listeners, and viewers is which antibiotics to have on hand for survival settings. I've received a flurry of these lately in response to our new book, Alton's Antibiotics and Infectious Disease. And indeed, in the book, I discuss, antibiotics and infectious disease, the infections to be expected in those survivors knocked off the grid, and the antibiotics obtainable by the average person that would help prevent otherwise avoidable deaths. By the way, I don't sell antibiotics, nor do I own any part of any company that does. Certainly, it would be great if you had the financial resources to have all of the medications that we talk about in Alton's Antibiotics and Infectious Disease, but that's beyond the means of almost everybody. You'll need to pick a limited number probably to stockpile. But which ones? Chances are if you lined up 10 doctors in a row, you'd get 10 different answers and you'd have to hide behind a couch while they duke it out amongst themselves. Your choices should depend on the infections you're most likely to encounter. Is it wound infections you're concerned about, or intestinal infections like dysentery or cholera? Does somebody in your group have a medical condition that makes them prone to a certain infection? Certainly, one drug does not cure all. Now, without knowing your individual situation, it's hard to give you specifics. I can, however, step out on a limb and give you my personal recommendations. There are a few antibiotics available in aquarium and avian form that I would definitely want in my survival medicine cabinet. This video would be too long to mention every disease these drugs treat or dosing of these drugs. Our book is more than 300 pages long, but I'll mention a little bit about each. 1. For those who aren't allergic to penicillin, I think either amoxicillin, Amoxil or Fishmox, or Cephalexin, Keflex or Fishflex, are both members of the beta-lactam family, would be good drugs to have around, especially for soft tissue and bacterial upper respiratory infections. Dosing is relatively simple, and in most cases, they're perfectly safe for pregnant and pediatric patients. Secondly, I would have doxycycline, Vibromycin, Dorix, or Bird Biotic, which handles a lot of different infections of the respiratory and intestinal tracts, and it's okay to take if you're allergic to penicillin. I will say that it's not considered acceptable for use during pregnancy, however. For those who claim doxycycline becomes toxic as a tetracycline family drug when expired, note that the Department of Defense's Shelf Life Extension Program has in the past authorized its use well beyond the expiration dates during shortages. Third, Metronidazole Flagyl or Fishzole. That's a drug I consider very useful, especially for intestinal infections from bacteria and certain parasites like Giardia. It's also used in combination with other antibiotics in those people that have very stubborn infections, for example, appendicitis, for situations where surgery is just not an option. Although metronidazole is acceptable in those people that are allergic to penicillin, it's not okay for pregnant or breastfeeding mothers. Fourth, I would say azithromycin. Maybe even third in that circumstance. Z-Pak or Bird Zithro. It's known to be generally safe in pregnancy as well as for those people that have penicillin allergies. That's a great thing. It's one of the nation's actually most prescribed drugs, and it can deal with many cases of respiratory infection, dysentery, tonsillitis, sinusitis, all sorts of things. And an additional benefit is that many people in your group will already have taken it before in its popular Z-Pak form. You'll know that they probably have tolerated it okay. Next, I would say clindamycin. Clindamycin is also known as Cliacin or fish sin, C-I-N, and that would also be on my list. It's been used to treat everything from acne to anthrax, but it's helpful especially for pneumonias, pelvic infections, uterine infections after childbirth, soft tissue infections, even effective against MRSA. It is like azithromycin, but unlike doxycycline and metronidazole, acceptable for use during pregnancy and in people allergic to penicillin. Of course, you could be allergic to clindamycin, really, or any other antibiotic itself. Each antibiotic has its adverse reactions. It's important to know that. And in rare cases, use of clindamycin, for example, could induce an intestinal inflammation of its own called colitis, which could be pretty serious. Last, the sulfa-drug combination sulfamethoxazole trimethoprim, otherwise known as Bactrim or Septra or fish sulfa forte. That is an excellent choice for many infections, especially those of the urinary tract. If that's a common problem for family members, you might definitely consider this drug. It has also been used for skin infections, some sinusitis, MRSA, ear infections, and others. Sulfa drugs are acceptable in the penicillin allergic, but not in the pregnant woman or breastfeeding mother. Now you may notice my list doesn't include ciprofloxacin, Cipro or fish flox. It's an antibiotic, however, that is very effective against many infections. I just felt that the side effects of the drug, including weakness of the muscles and tendons, really precluded my adding it for survival scenarios. It's still an option for some. In our book, we describe the various antibiotic families in detail. The drugs that I just mentioned each belong to a different family. If you can accumulate some of each over time, over a good period of time, it would give you the best chance of having a medicine on hand that would have activity against almost any bacterial infection. Now that doesn't mean that they're necessarily the best antibiotic for a particular job, just that I consider them reasonable choices from among the antibiotics that you can actually obtain. It's important for you to know that every single medication I mentioned has its share of side effects and reasons why they might be dangerous in some people, like those that have kidney disease or liver disease. You should also learn to recognize the signs and symptoms of these diseases and, of course, of bacterial and also viral infections. You have to know the difference between bacterial and viral. Indeed, antibiotics are not useful at all if you have misdiagnosed a viral infection as something bacterial. The bottom line, antibiotics are not candy, and they should be used judiciously and rarely, even in survival settings. They'll be scarce commodities, irreplaceable in a societal collapse, so accumulate a supply and utilize them wisely. To accomplish that goal requires not just funds, but a fund of knowledge and good judgment. If you're successful, you might just save the life of someone who otherwise might not survive in times of trouble. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching. Hey, don't forget to fill those holes in your medical storage by checking out Nurse Amy's entire line of medical kits at store.doomandbloom.net. That's store.doomandbloom.net. You'll be glad you did.